laser hair removal, you want to be clean shaven. That way we have no hair on the top of the skin that's singeing. And then you also want to make sure that you're free of any residue of deodorant, so we just wipe you off with a little bit of alcohol. You're free to apply an antiperspirant afterwards, but just make sure it doesn't have any exfoliating acids or chemicals that can irritate your skin right after laser. We do apply a cooling jelly that is also clear, like ultrasound gel would be. This is to help with a little bit of the glide of the laser, and also because the tip of the laser is cooling, when we're not actively shooting the laser out, it is going to help cool the skin as we do the service. So come back to see us in 4 weeks for anything upper body. Lower body will always be 6 to 8 weeks because we want to treat as the hair grows back in and it's in its growth cycle. The goal of laser hair removal is to reduce the density of hair, which is how many hairs you have per square inch. It's also going to reduce how thick, so fine, or the actual width of the hair strand. And then lastly, it is going to also slow your hair growth down. That way you're shaving way less often or not at all. You're going to do a series of at least 4 to 6 treatments, at most 10 to 12, with touch-ups as you see fit. Some people do it twice a year, some people do it 4 times a year. It just depends on obviously the starting thickness of your hair and then also how hairless you want to be. At your first laser appointment, it's gonna feel like a hot snap or even a light prick, depending on the thickness and density and also color of your hair. So it works best on dark hair, browns, blacks, dark blondes. Doesn't work great on blondes, grays, or reds, so you do have to have a specific pigment in your hair in order for the laser to pick it up. One thing you want to make sure of is that you aren't on any antibiotics or medications that would make you photosensitive to the laser. If you are, depending on what you're on, you might have to wait 2 to 4 weeks after you finish your course of medication to even come in for your treatment. You also want to avoid any type of self-tanning or obviously tanning bed or sun tanning if you're coming in, because the pigment in your skin can get picked up and it won't adequately treat your hair because it's too busy treating the pigment on the actual skin surface. We are able to treat all skin tones, Fitzpatrick's 1 through 6, and that's because we have multiple laser devices that are different nanometers that can bypass the level of pigment in your skin and just target your hair follicles. So if you're like me or darker, you can still get treated here too.